for a patient like this, first of all, I'm going to consider whether or not I need to do something directly for the pain, and that could be addressed perhaps with a focal treatment like radiation therapy, external beam radiation therapy, which can frequently be delivered in 1 or 2 treatments, and that might cause us to have a pretty rapid control, us to be able to gain control of the pain relatively rapidly. But that's not going to be sufficient to control the disease in the long run. And in the long run, he's going to need systemic therapy. So the considerations are comorbid illness, overall performance status, and general degree of disease burden. Now, in the abiraterone and the enzalutamide studies in which patients were chemotherapy naive, most of those patients were required to have a performance status of 0, 1, or 2, but they weren't allowed to be symptomatic from their disease. The thinking at the time was that these are patients who should probably be treated with chemotherapy. But now that the data are out and we know that abiraterone and enzalutamide are considered standard approaches in this setting, I think that we can safely address the issue of giving a patient with pain a systemic treatment such as this. Now, as I look at these 2 drugs, abiraterone and enzalutamide, one of the considerations are the differential side effects of the 2. So with abiraterone, we have the likelihood for hypertension, hypokalemia, and fluid retention, all of which are important and especially important considerations in the elderly. Aside from that, the toxicities may be skin bruising from the prednisone and occasionally liver function abnormalities. Enzalutamide, on the other hand, doesn't have the prednisone issues associated with it, and it doesn't have quite as much fluid retention associated with it. However, we do see with enzalutamide a significantly higher rate of fatigue, and that fatigue can be debilitating in some patients. And my sense is that elderly patients may have a slightly harder time with that. We also occasionally will see arterial hypertension or hypertension in those patients. And then finally, one of the major concerns in an elderly patient with the use of enzalutamide would be falls or gait abnormalities and things related to central nervous system penetrance and toxicity of the drug. So for this patient, for example, if I was worried that falls were a problem, I might steer away from enzalutamide. And in fact, in my personal practice, I generally use enzalutamide more in younger patients and abiraterone more in older patients. Finally, let's not forget that prednisone, which is part of the abiraterone treatment, actually has some palliative benefit associated with it. And so this is a patient with symptomatic disease. Now, whether or not we choose to give him radiation is one consideration, but the prednisone may actually help with that baseline pain consideration.